Some individuals report relief from depression within 24 hours after treatment, an effect that has drawn increasing scientific attention. That's the power of ketamine. If you've ever struggled with depression that just won't lift, ketamine might offer the breakthrough you've been waiting for. The science and promise of ketamine in mental health treatment, from anesthetics to antidepressants. Ketamine, initially synthesized in the 1960s as an anesthetic agent, was primarily used in surgical procedures due to its ability to provide profound pain relief and sedation. Its rapid action and relatively favorable safety profile made it a preferred choice, particularly in emergency medicine and for pediatric patients. However, in the decades following its introduction, scientists began to uncover unexpected properties of ketamine that extended beyond its anesthetic effects. In the early 2000s, clinical observations began to emerge suggesting that ketamine had significant antidepressant effects, particularly in individuals who had not responded to traditional antidepressant medications. Studies indicated that even a single sub-anesthetic dose of ketamine could lead to rapid improvements in mood, often within hours. This marked a pivotal moment in psychiatric medicine, as it provided a novel avenue for treating depression, especially in cases of treatment-resistant depression. The underlying mechanisms by which ketamine exerts its antidepressant effects are complex and still being researched. Ketamine functions primarily as an N-methyl-D-aspartate (NMDA) receptor antagonist, which leads to increased levels of the neurotransmitter glutamate. This surge is believed to engage various signaling pathways that enhance synaptic plasticity and promote neurogenesis, the process by which new neurons are formed in the brain. Additionally, ketamine's role in modifying synaptic connections is thought to help restore the neural circuitry that can be disrupted in conditions such as depression and anxiety. As the understanding of ketamine's therapeutic potential deepened, researchers began to explore its efficacy in various mental health disorders beyond depression, including post-traumatic stress disorder, PTSD, and obsessive-compulsive disorder, OCD. This evolution in perception has led to an increased interest in ketamine therapy and its applications in mental health treatment, underscoring its promise as a transformative tool in psychiatry. Clinical evidence: ketamine's efficacy in treating depression and anxiety emerging. Clinical and patient evidence. Recent clinical studies illustrate the significant role ketamine plays in the treatment of depression, anxiety, post-traumatic stress disorder, PTSD, obsessive-compulsive disorder, OCD, and other mood disorders. Research underscores the differences between ketamine and traditional antidepressants, particularly in response time and effectiveness. For patients who have not responded to conventional therapy, ketamine has emerged as a promising alternative. One key study published in the journal Biological Psychiatry revealed that ketamine administration could result in rapid alleviation of depressive symptoms, often within hours, compared to the weeks typically required for conventional antidepressants to exert their effects. In patients with treatment-resistant depression, a single intravenous dose of ketamine resulted in a significant reduction in symptom severity within 24 hours, demonstrating its potential as a fast-acting intervention. The mechanism of action seems to differ markedly from that of standard antidepressants. Ketamine appears to enhance synaptic connectivity in the brain, promoting neural regeneration in areas affected by mood disorders. This unique action may explain the persistent effects observed even after the drug has left the system. Follow-up studies have indicated that the benefits of a single ketamine session can last up to several weeks, suggesting a longer duration of action than previously anticipated. Patient testimonials further substantiate these findings, with many individuals sharing transformative experiences following ketamine treatment. Accounts describe not only a rapid reduction in depressive and anxiety symptoms, but also an improved overall quality of life. Such qualitative data enhance the understanding of ketamine's efficacy and provide valuable insight into real-world applications of this treatment method. Overall, the clinical evidence supports ketamine as a revolutionary option for those grappling with severe mental health challenges, opening new avenues for research and therapeutic application in the field of psychiatry. Mechanisms of action. How ketamine works in the brain. Why ketamine works differently. Ketamine, traditionally used as an anesthetic, has garnered significant attention in general, especially for its treatment potential in treating various mental health conditions, particularly depression and PTSD. At the core of its therapeutic properties are the mechanisms through which it interacts with the brain's neurotransmitter systems, chiefly through NMDA receptor antagonism. By blocking the N-methyl-D aspartate, NMDA receptors, ketamine leads to a reduction in the excitatory neurotransmitter glutamate levels, orchestrating a cascade of neurobiological events that can enhance mood and cognitive function. The modulation of glutamate is crucial, as this neurotransmitter is central to forming and stabilizing synaptic connections in the brain. The release of additional glutamate following NMDA receptor inhibition promotes the activation of AMPA receptors, which in turn facilitates synaptic plasticity, the brain's ability to adapt and reorganize itself. This neuroplasticity is essential for learning and memory, and it posits that ketamine may help restore synaptic function that is often compromised in individuals with depression or anxiety disorders. Moreover, ketamine's neuroprotective effects may also be attributed to its anti-inflammatory properties. Studies indicate that inflammation plays a role in the pathophysiology of mental health disorders, and ketamine's ability to reduce markers of inflammation may be a vital aspect of its efficacy. By mitigating neuroinflammation, ketamine may promote a healthier brain environment conducive to recovery. These mechanisms collectively provide insight into how ketamine not only yields rapid symptom relief, but also stimulates enduring changes in brain function. This transformative potential positions ketamine as a promising alternative in the realm of mental health treatment, representing a significant shift from traditional therapeutic approaches that can take weeks to show results. Challenges and future directions. Ketamine's role in mental health treatment. The use of ketamine in mental health treatment has shown significant promise, yet it is accompanied by various challenges and limitations that need to be addressed. One of the primary concerns is the potential side effects associated with ketamine therapy, which can include disorientation, dizziness, and perceptual disturbances. These side effects may limit the broader acceptance of ketamine as a first-line treatment for mental health disorders, particularly when compared to more established therapies. Additionally, the long-term safety of ketamine has not been thoroughly evaluated, raising valid questions regarding its prolonged use and potential for dependency. But here's where things get interesting. Moreover, the current research surrounding ketamine tends to focus largely on its efficacy for conditions like treatment-resistant depression, while other possible applications, such as for anxiety disorders and PTSD, remain understudied. There is a pressing need for further research to explore combinations of ketamine with other therapeutic modalities, such as psychotherapy. Preliminary studies suggest that integrating psychotherapy with ketamine treatment could enhance therapeutic outcomes, leading to more sustainable recovery for patients. Looking ahead, the future of ketamine in mental health treatment. This requires careful consideration of ethical implications, particularly regarding access and equity in treatments. Ensuring that all patient populations, regardless of socioeconomic status, have access to these innovative treatments is crucial. Furthermore, as new compounds resembling ketamine are investigated, and understanding their safety profiles and mechanisms of action will be paramount. The landscape of mental health treatment is rapidly evolving, and ketamine could play a pivotal role in revolutionizing how mental health disorders are treated, provided that these challenges are appropriately addressed. If you or someone you care about is facing treatment-resistant depression or other complex mental health challenges, ketamine therapy may be a treatment worth learning more about. Consulting with a qualified provider can help you explore whether this evidence-based, innovative option aligns with your needs. For ongoing education about emerging mental health treatments, subscribe and stay informed. Understanding ketamine for mental health at Balanced Mind Psych. A new path for treatment-resistant depression, PTSD, and anxiety at Balanced Mind Psych. We're committed to educating and empowering you with the science behind it. Why consider ketamine treatment? Rapid relief. Ketamine can relieve symptoms of depression and anxiety within hours, unlike traditional meds that may take weeks. Evidence-based, supported by leading research for treatment-resistant depression, PTSD, and more brain healing potential. Stimulates neuroplasticity and synaptic repair, helping your brain rewire for long-term change. Works when others don't, especially effective for people who haven't found relief with standard medications. Why choose Balanced Minds? Psych. Affordable cash options. Affordable pricing, without sacrificing quality insurance. Accepted soon. making care even more affordable without breaking the bank. Same-day and evening appointments, prioritizing your schedule and your healing, trauma-informed, supportive care, safe environment, experienced clinicians, integrative approach, innovative alternative treatments, therapy, or medication as needed. Visit us, Balanced Minds, Psych 736 S900E, Suite B, 107 Vertical Bar, St. George, Utah 84790. Call 435-218-7352. Website balancedmindspsychandtmbw.com. Follow for educational content and real stories. Instagram Vertical Bar, Facebook Vertical Bar, YouTube ETM Cox Balanced Minds Psych. Like, if you're curious about ketamine, share with someone who's still searching for answers. Subscribe to at Tim Cox Balanced Minds Psych for expert mental health info. Disclaimer: this video is for educational purposes only. It is not intended to promote or endorse any specific treatment. Always consult with a licensed medical or mental health provider before making treatment decisions.